What if I told you that the most effective healthcare system doesn't start in a hospital, but it starts in the streets? 12 years ago, between finishing my master's degree and beginning my PhD, I took my kids on a cross-country road trip to California, a sorry mommy's going back to school for a little longer adventure. We explored much of Southern California. During our time in LA, we unexpectedly found ourselves in the heart of Skid Row. Despite my own past experiences with mental health, addiction, and poverty, I had never witnessed homelessness to this scale. I felt an overwhelming pull to give back, but what truly moved me was watching my kids, eyes wide open with compassion. We saw people seemingly miserable, hungry, sunburnt, surrounded by their worldly possessions, living in filth. Mom, can I have some money for this man? Mom, can I get $1 for this lady? Mom, please, these kids need food. This sight and these interactions is something that shook deep within inside me. That moment planted a seed, and it slowly set the wheels in motion for a future where I could attempt to create lasting change for those often left behind, those unseen. Through this serendipitous introduction and a spontaneous meeting with a strong woman driven with passion for social justice and a fierce desire to create change, I met veteran Dr. Shannon Emery. She became my chief medical officer and co-founder. We created a street medicine team. What does street medicine do, you might be asking? Well, with the power of now 50 volunteers, we go into our community where people are experiencing homelessness, and we offer them medical, mental health, addiction, and cultural care on the streets. My first ever day out on the streets, it was a hot August morning. We came across a group of people, and we told them who we were, what we were attempting to do, and asked if they had any medical needs. Out of left field, a man asked, "You got a leg over there?" We were all taken back by this request, and we looked around to see who had asked, and there was a small, smiley, middle-aged man drinking a tall boy in his wheelchair, and he was in fact missing one leg. We explained to him that we did not have a right leg on us, we only had a left, and then we all laughed, and then we remembered to pause, to sit down and have a conversation. We needed to build trust and create rapport. And it wasn't until several minutes later that he asked for a Band-Aid, which prompted the medical team to ask more questions. He told us that he had been hit by a car while crossing the street, lost most of one leg, and feeling the other due to physical trauma. Then, on a cold South Dakota winter night, while waiting to get into the shelter, he got frostbite on his remaining toes. He wanted a Band-Aid for what turned out to be a horrible infection. We tried to get him to go to the hospital, but he refused. The medical crew cleaned his wound and wrapped it up. And just like that, he was on our list to check on every week. And we were lucky. Most weeks we did find him. The medical crew always checked his foot, redressed his wound, asked what his needs were, and sometimes we sent him to the ER because of infections, and one time we cleaned maggots from his wound. The premises of street medicine is to go to the people. Healing doesn't start with a prescription, it starts with showing up. We started with rapport, unconditional love, a little snack. Food is love. And as noted, some of the things that we were asked for while we were doing our needs assessment, we just weren't unable to give, right? AKA that right leg. But other asks were really just access to resources that already existed. Harm reduction supplies such as vaccines, condoms, Tylenol, Motrin, or other common needs that humans should have access to. Other things we attended to were infectious disease testing, medication refills, and access to addiction medications. And often, we were just someone trusting and caring that could help them goal set and treatment plan. Take this ride with me, if you will. Could you imagine 100 or more people walking past you in one day and no one actually seeing you? No one asking you how you were, even when it's clear that you might not be okay and you could use a little love. No one saying hello or even making eye contact with you. Can you fathom what that would feel like day after day? Desperate, heartbroken, misunderstood, sad, disconnected, excluded, overwhelmed, hopeless, defeated, paralyzed, isolated, lonely, powerless, invisible. And that sense of invisibility, combined with the overwhelming systemic barriers to basic needs, can make survival feel impossible. And it's unfair to oversimplify and tell someone living on the streets to just get a job when they lack the most basic necessities like food and shelter. Securing employment often depends on having some essential items like an ID, a reliable phone, a bank account, a stable address. And without these, the barriers to finding work can seem insurmountable. Please remember, you cannot pull yourself up by your bootstraps if you don't have boots to begin with. And truthfully, many of us are just one financial burden away from living this perspective firsthand. So I'd like to ask, how long could you sustain yourself if you lost your job today? Consider your savings and liquid assets. How much could you afford to lose before facing hardship? With the average breast cancer treatment costing $100,000 a year and an ER visit $1,000 to $2,000, would your financial buffer be enough to keep you in your home? The results of a national survey by Bankrate say that 57% of Americans could not make it through a $1,000 crisis. And it's not just the lack of money that can catapult someone into homelessness. It's the combination of unexpected crises, lack of support, and systems that aren't built to catch people when they fall. We often think that homelessness is on an individual basis, yet it's deeply systemic, and the broken model of healthcare is part of the problem. I have been a professor for well over a decade now, and for as long as I've been teaching, I've been telling my students, you have to meet people where they're at. But until the first time I met the homeless man with a missing leg and an infection in his other leg, living on the streets in his wheelchair, I, myself, had never met anyone where they were truly at. When we first went out, I used to fill my backpack with things that I thought people needed, like Narcan and fentanyl testing strips. But now I fill my backpack and my wagon with things that people that have taught me that they need, like hats and socks and gloves and water. And of course, I still have Narcan and fentanyl testing strips just in case. But I have found that if you want to help people, you have to truly listen to those people. They will tell you what they need, directly or indirectly, but you have to be willing to listen. And those people we are listening to. They're someone's child, parent, or friend. They're someone who people mourn when they're gone. And sadly, we mourn the loss of people experiencing homelessness. The average homeless person dies 20 to 30 years earlier than their housed counterparts, dying at the ages of 42 to 52, opposed to the average of 76. Inconsistent medical care, trauma, addiction, mental health, and stigma concerns are large factors in these early deaths. But a key factor in preventing these early deaths is understanding how to live safely. Have you ever wondered why you see people experiencing homelessness sleeping during the day? It's because this is when they're safe, in the light of the day. I will never forget sitting on the curb in the blazing sun, talking to a woman who had just been stabbed in the knee. She was telling me that she was ashamed and embarrassed that she uses meth at night as a tool to stay awake. She was asking for female condoms and said that she'd been assaulted and feared for her body's safety at night. I still think about this conversation, honestly, almost daily. And it continues to inform me that street medicine is vital to bringing dignity, compassion, and care to those who need it most. Street medicine redefines healthcare and meets people where they're at. So, where is the man without the leg now? After yet another hospitalization for yet another infection that resulted in ultimately losing his other leg, he is in assisted living after years of living in homelessness. As of now, he is sober. He has just received 2 new legs. He's in PT, and he can walk again. We are so proud of all the hard work that he put in to get there. And he said that he has nothing but gratitude for the services that we provided him. Our whole street medicine team acknowledging him, loving him, checking on him, giving him care, cleaning maggots out of his wound, and advocating for him at every step of the way. And thank goodness, because honestly, I'm not sure that he could have made it through another South Dakota winter living on the streets in his wheelchair. His light has always been there, but it is a lot brighter these days. And part of the reason why is because instead of being met with fear, he was met with compassion. When we don't understand or cannot relate to something, our primal brain tells us that that thing is scary. And our natural tendency is to avoid or evade scary things. And that brings me to my call to action. I challenge you to see the unseen. You don't have to give people money if you're not called to that. You can give whatever it is you have to offer: a wave, a fist bump, a high five, a handshake, a hug, a simple greeting, whatever is authentic to you. Acknowledging these people with value and worth brings back their humanity. And that's one of the first steps to recovery. Homeless people are people you just haven't met yet. People who want to be seen, respected, cared for, and loved just like anyone else. And your interaction could make a huge difference in someone's mental health. Think about a time that someone did or said something nice for you, something that gave you hope, something that inspired you, something that made you feel loved. You can be that person for somebody else who might really need you. Healing starts with human connection, and that's something we can all give just by seeing the unseen.